Physical therapy interventions for patients with femoroacetabular impingement. The hip joint is made up of the femur, the pelvis, and the soft tissues called the articular cartilage and the labrum. The labrum is a rubber ring of cartilage that seals the joint, and it also acts as a shock absorber. The cartilage and the labrum allow the hip bones to move smoothly. If these bones are in abnormal shape, they can damage the soft tissue, cause pain, and limit the range of motion of the hip. This is called femoroacetabular impingement, or FAI. There are three types of FAI. The first, called the cam lesion, is when the neck of the femur is thicker than it should be. The lesion can pinch the labrum and damage the cartilage. The second, the pincer lesion, is when there is an extra bone at the edge of the socket. It can also pinch the labrum. The third type, the sub-spine lesion, is when an area of bone just above the socket, called the anterior inferior iliac spine, is too large. The labrum can get pinched between the femur and extra bone. For the hip flexor stretch, the patient is going to kneel on the floor with the trunk upright. Then, they gently lean backward or move the pelvis forward until they feel a stretch on the front of the thigh. The external rotation stretch, the patient is lying in the back with the hips bent and places the affected leg's ankle on the opposite knee. Then, with both hands, assist moving into external rotation. Another great mobility exercise are hip joint glides. The patient is going to be in all four point kneeling position and then gently rock backwards until the point of discomfort. Forward lunge, the patient is standing straight and then takes a step forwards and bends their knee. Then they return to the starting position and repeat the same procedure with the other leg. For hip bridges or bottom lifts, the patient lies on their back with the hip and knees bent and the TheraBand around their knees. Then, while keeping tension on the TheraBand so as to keep the knees apart, they lift the hips and lower the hips again.